So next we will be studying about Allen test. What is Allen test? You got the types of acidosis and alkalosis, I think. Okay. So next I will be explaining to you what is Allen test. So Allen test is a simple clinical assessment that is performed before taking an ABG sample. So we take the ABG sample from radial artery, radial artery. Okay. So this is the radius bone and this is the radius artery. You can palpate it over here and feel your radial artery. So we take the ABG sample from radial artery. So why do we perform the LN test? Why do we need to perform the LN test? We need to perform the LN test to check if the radial artery or ulnar artery is patent. Okay, the patency. Okay, whether it is open or not, or whether it is clotting. Okay, so the steps of LN test. So first step is we will ask the patient to make a fist of their hand. Okay, the patient will be making the fist of their hand like this. So then examiner, what examiner will do? Examiner will be blocking the radial artery and ulnar artery of the patient. Okay, so he will be like blocking both the arteries. You can also see in the image. Okay, so the examiner will put two fingers on each side and apply pressure. Okay, so the blood flow to the hand will be blocked. Okay, then we will ask the patient to open their hand and we will assess the color of the hand. So the color of the hand will be pale, but after that we will be releasing pressure from ulnar artery side, so the hand will become pink. Like my hand is becoming pink now. When I was applying pressure, it was pale, but when I released the pressure from ulnar side, my hand became pink. So if it is becoming pink, the ulnar artery is patent. Okay, the ulnar artery is open and circulation is not compromised to the hand. So we can perform radial artery puncture or ABG sample we can take from radial artery. I think this is clear. Okay. So the LN test indicates the patency of radial and ulnar artery. We can perform it on both the arteries likewise. Okay. So we can assess the patency of radial artery also and ulnar artery also. So in negative modified ELN test, what is it indicating? It is indicating when we release the pressure of on the ulnar side, the hand flushes within 2 to 5 seconds. Okay, so when the hand become pink, it means the ulnar artery is patent, as I told you. But if we release the pressure and hand still not become pink, it is still pale, that is indicating positive modified LN test. And in positive modified LN test, we cannot perform ABG sample. Okay, we cannot take ABG sample from radial artery because the collateral circulation is compromised. What is collateral circulation? Likewise, two arteries are moving side by side. So if one artery is blocked, the other artery will supply to that part of the body. Okay, for example, hand, there is radial artery and ulnar artery. If the radial artery is punctured or traumatized by the ABG sample, so the ulnar artery will be supplying blood to the hand and our circulation will not be compromised. Okay, so its main function is to assess the patency of both the arteries before taking an ABG sample. After we take an ABG sample, so the ABG sample is taken through heparinized syringe. Okay, it is just okay. So next we will be understanding about ABG. Okay, so as I told you, the normal pH of our body is 7.35 to 7.45, and the normal bicarbonate level is 35 to no 22 to 28, and PCO2 level is 35 to 45 mm of Hg. Okay, and the PO2 level is 80 to 100 mm of Hg. PO2 partial pressure of oxygen. So when we performed the ABG sample and when we got the report of ABG, we will be looking at certain values. So let me just tell you about how to interpret an ABG. Okay, so before interpreting an ABG, we should know that normal range of blood is 7.35 to 7.45. First of all, before when we are interpreting the ABG, we will be looking at pH value. If the pH value is less than 7.35, it is indicating acidosis. If the pH value is more than 7.45, it is indicating alkalosis. Okay, so we looked. For example, I gave you an ABG and the pH was 7.12. So You understood that it is acidosis. Then you will move to next value. What the next value will be? PaCO2. You will be checking the value of carbon dioxide. When you will be looking at carbon dioxide, you know that the normal carbon dioxide is 35 to 45 mm of Hg. Okay, so if PaCO2 level is more than 45, it is indicating acidosis, respiratory acidosis, and if it is less than 35, it is indicating respiratory alkalosis. Okay, so uh, for example, in the ABG which I gave you, the pH was 7.12 and the PCO2 was 15.8. So what does it indicate? It indicates respiratory acidosis. Okay, the CO2 is indicating the respiratory system. Okay, the next step of our ABG interpretation will be, we will be looking at bicarbonate level. Okay, so when we will be looking at bicarbonate level, we know that normal value of bicarbonate is 22 to 28. So the ABG which I given you, I also mentioned in that the bicarbonate level is 26. So you will be saying, ma'am, bicarbonate level is normal. So the what does the ABG interpreted? The ABG interpreted that the patient is going into respiratory acidosis and it is not compensated. What does compensation means? Means that the value of bicarbonate is not changing to normalize the value of carbon dioxide. Then you will be asking me, ma'am, why will the bicarbonate level will be changing? So the bicarbonate level will be changing to compensate the value of carbon dioxide. For example, in this case, the carbon dioxide was like 58. Okay. So what is bicarbonate? Bicarbonate is a basic entity. So if inside our body respiratory acidosis has occurred, so the basic entity will be increasing itself to make a buffer with acidic entity. Okay, so the bicarbonate will be increasing. For example, it was an uncompensation case, but if the body is trying to compensate the respiratory acidosis, then the level of bicarbonate will be increasing inside our body because the bicarbonates are basic. So it will be trying to manage the level of CO2. So for example, so this was an uncompensated case. Further, I will be giving you the compensated case example. Then, when the bicarbonate level got increased, so they will be maintaining the pH to normal value because the base is increasing. Okay. So, when we look at an ABG, so how does we decide whether it is compensated, uncompensated, or partially compensated? Okay. So, we will be looking at the pH. If pH is between normal value, okay, between 7.35 to 7.45, it indicates that the value has compensated already. Then we will be looking at the value of PaCO2 and bicarbonate. So we will get an idea whether it was respiratory or metabolic because it is already compensated. Okay. So I already told you partial pressure of oxygen is 80 to 100 mm of Hg. Okay. So next is, how does we interpret the whether it is respiratory acidosis, respiratory alkalosis? I just explained to you. I will be explaining it with the help of examples also. So, in case of respiratory acidosis, there will be lower pH. You all know that, okay? There will be high PaCO2. You all know that. There will be normal bicarbonates. If bicarbonates are within the normal range, then compensation has not done. That means it is uncompensated. So, when the compensation will be occurring in the body, the bicarbonate level will get increasing. Okay, so next we will be moving to respiratory alkalosis. How does respiratory alkalosis indicates? So in respiratory alkalosis pH will be high. Okay, CO2 will be low, bicarbonate will be normal because it is not compensated. If the pH has come into normal value, then bicarbonate must have increased. Okay, so you are just looking at the normal case right now. So let's just focus on the normal case. So I think you got the point of respiratory acidosis and alkalosis. Okay, so next is metabolic acidosis. What is metabolic acidosis? So in metabolic case, firstly we will look at pH only. Okay, so pH will be low. Then we will be looking at bicarbonates. So bicarbonates will be also be low. Okay, so bicarbonate is a basic entity. So bicarbonate will also be low. Okay, then PaCO2 will be normal. So this is uncompensated. Next, we will be looking at metabolic alkalosis. What is metabolic alkalosis? In metabolic alkalosis, pH will be increased, bicarbonates will be increased, and PaCO2 will be into normal value. So this indicates metabolic alkalosis. So whether it is metabolic alkalosis or acidosis or respiratory acidosis or alkalosis, we just firstly have to look at the patient condition. Okay, for example, the patient is of respiratory, for example, COPD, pneumonia, or diabetic ketoacidosis. So we will get a firstly we will get an idea about how the patient body mechanism is doing, and further we can classify it also by looking at the ABG levels. Okay, so now we will be doing some questions regarding the ABG, and I'll be asking you the questions and you will be answering me that. So that will be making me clearer that you got my point. What is I'm trying to explain you what is ABG and how to solve the questions. Okay, so let me just ask you some questions. Okay, is it clear?